Hey, Ashley, thank you for being here today.
Thanks for having me.
Yeah, I really want to just take some time to inform other providers and school staff about Christian Family Solutions and our online day treatment for teens. This option is especially good for those who maybe have no transportation or have no access to this level of care. And I want people to hear from you as the leader of this team. What types of clients would do best in an online day treatment program, or have you seen do best?
Yeah, I think if we're talking about school specifically, we have these kids who just have a really hard time getting to school, whether it's anxiety or things going on within the school environment that they're struggling with. If we're able to help them get into a program that, again, if they were physically having to go in person, they just wouldn't go, which is kind of why you're not seeing them come in through the school doors because they're just not ready to be face to face with other students at this point. So if you have a kiddo who's been seeing a therapist for a few months and they're still not getting to school, their grades aren't getting better, you're just not seeing those needs being met yet at this point, that's when we would say maybe we need to try something different. We need to try something more. So traditional outpatient is usually an hour a week. Our program is more intensive than that. We're 2 hours, 5 days a week. We have schools throughout Wisconsin and we don't have clinics throughout Wisconsin. So we're a great resource for those kiddos who don't have resources within driving distance that they could go to. So we're providing a resource that otherwise wouldn't be there because we're not in their physical location, but they can meet with us anywhere from Wisconsin.
For providers who may not know much about Christian Family Solutions, does it look like?
Yeah, our online program runs Monday through Friday, 1 p.m. to 3 p.m. Again, we're virtual. So if we have kids that need to connect right from school, they're able to do that. We have some kids who will leave on their lunch hour, drive home, connect from their home. But it is Monday through Friday from 1 to 3.
Okay, what's the average length of your program and why is that an important piece?
Yeah, our program is 4 to 6 months. That feels long for some schools, and I think they definitely ask, why this much time? And there's a lot of reasons for that. I think we want kids to leave our program feeling successful. So step one is helping them feel safe in our group environment, which takes some time. Step two is teaching them the skills. And then step three is helping them apply those skills day to day. And that just takes time. There's a lot of steps that need to happen. And I think too, many of our kids have new stressors that show up even while they're in group. So then we work through those as well.
And I imagine your goal is for them to go on, be successful, and not need to come back.
Yeah, we want our kids to leave group feeling like they're ready. I think most often our kids will still meet with an outpatient therapist after group, but again, that's 1 hour a week. But when they leave our program, we don't want to see them cycle back into our program. We want them to stay and be successful in school after that. So if we can get them for that 4 to 6 months and then send them on, that's typically when we see the most benefit from the program.
You brought up something about aftercare. How does that work with your program?
Yes, great question. So for aftercare, typically, like I said, we would refer them back to if they were already seeing an individual therapist, they would go back to that person, or we would help them find an individual therapist. We also do a DBT skills group that meets 1 hour, 1 day a week. So we kind of try to combine those two, where they go from 5 days a week, 2 hours of treatment down to just 2 hours a week between the skills group and their individual therapist. So kind of that gradual transition. And then ideally the goal would be that they would meet with their individual therapist every other week and then scale back from there.
You also mentioned collaboration. What does that look like when a teen enters your program?
We do monthly meetings on each of our kids in the program. In those monthly meetings, we consult with parents, we consult with school, if there's a social worker involved, anyone who's involved with this kid's treatment, we pull them into the meeting. Again, they don't physically have to come to the meeting, but we would reach out to them and say any updates, anything significant that we should be aware of. And we're always trying to keep them in the loop of, we're planning on discharge in 2 months, or we're thinking this is going well. like I said, those meetings happen once a month, and we're always trying to keep everyone who's involved on the same page.
Okay, let's talk about modalities and sort of the types of skills and activities that you incorporate that providers can maybe pass along to parents, specifically in your format, to really help teens overcome their challenges.
Yes. So because we're an intensive program, the kids that we're meeting with need a lot of skills. And I think the skills that we have found to be the most successful are what we would call DBT skills, or dialectical behavioral therapy. We also incorporate some CBT, cognitive behavioral therapy, in that, but the base of what we do is DBT. But we often try to incorporate fun activities. So if the skill is mindfulness, how can we present that in a fun way that's interactive while we're virtual?
I know you can't expect, I mean, most of us, are doodling. I'm not right now, but, for 2 hours is a long time on the screen. So what do you kind of permit or allow, and what's okay in a virtual day treatment?
Yeah, I think that's a great point. I think when we're staring at a screen for many hours, how do we keep their focus? How do we keep them engaged? We do encourage them oftentimes to have a journal, so they're writing things down. I think too, having a fidget handy. I think the other really great thing about virtual is you have the comfort of your own home. So if there's a fidget tool that you want to have next to you, if there's a pet that you need to have in the room, like those things are all options because we're virtual. So we definitely encourage them to find those things that are going to help them stay engaged and not be distracted, but also give them that sense of comfort.
Yeah, I'm thinking of wintertime, cozy blanket and slippers.
Yes, yes. Mm-hmm. Very much so.
Tell me about clients who transition from a higher level of care. Can they do well in a program like this?
Absolutely. I think we're a great option as a step down. So if we have a child who's been inpatient in a hospital setting to come down to, again, 5 days a week of treatment is going to be way more beneficial than 1 hour once a week at most with an individual therapist. So it's kind of a nice transition. Again, they would be with us for 4 to 6 months, and then they would step down to that lower level, and just gradually work back from that. But I think it's a huge resource that we can provide for those kids leaving the hospital setting.
To help viewers of this interview understand maybe who would not be a good fit for this type of program, maybe there are certain diagnoses that just don't do well in this type of virtual program. Maybe you can address that.
Yeah, I think the biggest pullback I would see from this program would be kids who aren't able to sit in front of a screen for 2 hours. We do have resources where, like, if they're connecting from school, we can call the school, we can call a parent if they're at home. But if they're not able to stay in front of that screen and they're not able to participate in the group activities because they're so distracted by the stuff going on around them, or just their behaviors are more than they can manage, we might ask that they would do an in-person setting versus a virtual setting.
What makes this day treatment at Christian Family Solutions effective, especially long-term? And I know you talked about collaboration, parent involvement, no parent involvement. What really makes this work?
Treatment can't be effective if we can't get them into treatment. So I think the biggest thing is that we create an environment where they feel safe and they can feel connected to other peers. I truly wholeheartedly love group therapy because kids learn best from other kids. I think when they're talking to an adult, it's sometimes in one ear and out the other. But when they're hearing from other kids who have similar struggles and are their same age, they can just really retain so much more of what they're being taught. And that's what I love about group therapy. And again, I think it's really cool that we're virtual and they can learn from kids across the state, that they know there's other kids who are going through things that they are going through also. I also love, like we talked about earlier, that we incorporate a parent piece and an individual piece, because that's important as well. But I think the most work gets done within those group settings where they're learning from each other.
How do you integrate faith, and do you have to be Christian to attend?
You do not need to be Christian to attend. We incorporate faith on an individual basis. Sometimes we'll talk about it in group. If we have an individual who's very active in their faith, we might talk to them about that or encourage them through that. while alongside a group member who might not be as active in their faith, and we wouldn't just incorporate that into their treatment or when we're having dialogue with them. So we have a gauge based on where they're coming from.
Last question, could you share an example of a teen who needed day treatment and participated in the online program and is thriving today?
Yes, I think there are many stories that I could share. We've had kids come into our program who aren't able to go to school for whatever reason. When they graduate from our program or they successfully complete our program, they're able to get back into school and be successful. There's many stories that I could share that fall into that category, that we're able to get kids from not being able to function or make it through their day-to-day life to where they're able to thrive.
Thank you.